How do we battle the stigma of mental illness and encourage people to get help for mental health issues and to see mental health as part of their overall wellness?
That's such an important question. The sad part is that many young people suffer in silence, and it takes on average 10 years from the time symptoms arise to the time people actually get diagnosed. And during those 10 years, people are suffering, and their families are suffering, and that has to change. And part of what is going to change that is finding ways to remove and change these negative attitudes that are still associated with mental illness. And they're still there. As Liz mentioned, every time there's a mass shooting, and we talk about it as the result of a mentally ill person's actions, that leads some people to believe that all people who are mentally ill are violent. And that's not the case. I want to be very clear about that. People with mental illness are far more likely to be the victims of violence than to be the perpetrators of violence. So we have to be careful there. But the other thing is, if you think about it, what actually shapes people's attitudes around mental illness? It's not what they read about in a textbook. It's actually what they hear about mental illness from their family, from their friends, from the people they trust in communities, from their church leaders, their synagogue leaders, their mosque leaders. And that's why it's incumbent upon all of us to actually change how we and the people around us think about mental illness. And we can do that in a few ways. One is, if we know somebody who's struggling with mental illness, we can make it clear to them that we support them and we're there for them. Too many people with mental illness feel that they're struggling alone. The second thing that we can do is, if we are suffering with mental illness ourselves, or if we're concerned, we can not only seek help, we can find the courage to talk about it. And that's not easy. I want to be clear. I know it's not easy. When you talk about things that are hard to talk about, that have stigma still associated with them, sometimes they can subject you to the criticism of people who may be ignorant. But that courage is important, because when you stand up and you say something, you give other people the permission to do the same. That's what leadership is. And all of you can be leaders in that regard. And the last thing that we can do is we can encourage the leaders in our communities, our faith leaders, our business leaders, and others, to talk more about how to make mental illness something that can be dealt with and discussed in the workplace, in schools, in universities. I've met employers around the country, folks who run businesses, who have recognized that mental illness is not just a terrible thing for individuals, but it affects families, communities, and businesses. They know that mental illness is a reason why people miss work. It's a reason that it's one of the things that contributes to declines in productivity. And that means that businesses should have a role in helping to create a culture where mental illness can be talked about, where people can get connected to help. So all of us have a role to play in shifting how we think about mental illness. And that includes, and especially includes, youth. Because as I said in the beginning, mental illness affects far too many youth. And we have to make sure that we are identifying people who need help and getting them the help they need as quickly as possible.